Namaste everyone. This is Dr. Meenakshi. Welcome back to Dr. Meenakshi's classes. So, we are moving to our next topic, that is fifth topic of part A, Navajata Shishu Paricharya. So, we'll see today what is this Navajata Shishu Paricharya and what all topics are covered. But as this Navajata Shishu Paricharya is very lengthy topic, so we'll divide into Navajata Shishu Paricharya part 1, part 2 and part 3. In this part 1, part 2 and part 3, I'll divide the sections particularly and I am going to explain. So today we'll see the part 1 of Navajata Shishu Paricharya. So we are going to deal with the Navajata Shishu Paricharya. What is this Navajata Shishu Paricharya? According to our acharyas, Navajata is from birth date till 120 days, the baby is known as Navajata. So they divided the 120 days into 3 sections and they explain what all Paricharya. Paricharya is nothing but procedures. So Navajata Sishu is newborn. The newborn procedures which we are following to take care of a newborn are mentioned under Navajata Sishu Paricharya. So this Navajata Sishu Paricharya again will be divided into 3 sections. Has Jatamatra Sishu, Sadyojata Shishu and Navajata Shishu. So this Navajata Sishu Paricharya is again divided or explained in the form of 3 categories, that is Jatamatra Sishu, Sadyojata Sishu and Navajata Sishu. Whereas the Jatamatra Sishu is the baby refers to immediately after birth till cutting of umbilical cord. Immediately after birth, from first second of a birth till cutting of umbilical cord, the baby is known as Jatamatra Sishu. Whereas Sadyojata Sishu is the baby from the time of birth, immediately after birth till 24 hours of birth is known as Sadyojata Sishu. And whereas Navajata is the baby from birth till 120 days, the baby is known as Navajata Sishu. So these all 3 categories will be explained in Navajata Sishu Paricharya. As the procedures under Jatamatra Sishu will see. So what is this Jatamatra Sishu? As we came to know, Jatamatra is the baby from birth till cutting of umbilical cord. The baby is known as Jatamatra Sishu, right? So in this, as our acharyas mentioned, the immediately after birth, what all procedures will come under Jatamatra Sishu are Pranapratyagamana, first point, that is, as we know what is this Pranapratyagamana, I'll write here so that it will be clear. So that is Jatamatra Sishu. And Sadyojata Shishu is from birth till 24 hours. And Navajata Shishu from birth till 120 days. So these are the 5 terms which we are going to see. So these are the terms which we are going to see in this Navajata Shishu Paricharya. So now, this is whole. That is Jatamatra Shishu, Sadyojata Shishu and Navajata Shishu. These 3 procedures, what all we are going to do in these 3 particular pattern or from birth till 120 days according to procedures, we are going to see whole in Navajata Shishu Paricharya. So in this session, in this part 1, we are going to see the first one, that is Jatamatra Shishu and its procedures. So Jatamatra Shishu Paricharya. We can't do this, right? We'll write here. So today we are going to see Jatamatra Shishu Paricharya. So what is this Jatamatra Shishu Paricharya? As we came to know, first thing is Jatamatra Shishu is the baby immediately after birth till cutting of umbilical cord is known as Jatamatra Shishu. So what all procedures may be included here? First one is Pranapratyagamana. Pranapratyagamana is nothing but, as we all came to know in last class, right? That is neonatal resuscitation. I think I no need to explain here again Pranapratyagamana. If you want to know, if anyone is new who is not seen the 4th video or 4th point video, then you can go for the Pranapratyagamana or neonatal resuscitation point. You can find the explanation of Pranapratyagamana there. That is nothing but neonatal resuscitation. Whoever the baby is having respiration problems, respiration distress, like maybe the respiratory system and cardiovascular system didn't take its functioning immediately after birth, then that baby is subjected to the Pranapratyagamana, that is neonatal resuscitation, right? In this, in first 1 golden minute, we are going to resist or make the baby to survival for the normal with the normal respiration cardiovascular system, that is Pranapratyagamana. So detailed explanation you can see in the 4th point of part A, that is last video. And even I showed the practical session of this Pranapratyagamana neonatal resuscitation also, you can go through. The next is Ulbashodana. Next procedure in Jatamatra Shishu Paricharya is Ulbashodana. That is nothing but the garbha is covered with the fine paste like the substance is called ulba or vernix caseosa, right? We all know it. This ulba or vernix caseosa will be attached to or smeared with the baby skin, whitish thick paste you can see on the newborns immediately after birth, right? That is nothing but vernix caseosa or ulba. Removing this from the skin, this procedure is known as ulba shodana. Veshtite jayate ena garbhasa ulbaha prakirtitha. Means from the definition of ulba may be equated to vernix caseosa or fetal membrane. At birth, the skin is covered by a white colored paste, as I said. This is nothing but vernix caseosa. It is formed by the secretion from the sebaceous glands and the degenerated epidermal cells and hairs. This is covered. This will be covered to the newborn skin. It protects the skin from macerating actions of amniotic fluids. Why it will be present on newborn skin? To protect the skin from the macerating action of amniotic fluid in a womb or garbha. The procedure of removal of vernix caseosa from the body of a neonate is known as Ulbashodana. And this is not practiced nowadays. What is this procedure? We came to know. But nowadays has technology developed and the complications also developed. Many things got changes, right? These all procedures were explained by our acharyas. Nowadays it is not practicing. Why? Because vernix caseosa is a powerful medium for maintaining the thermal stability of a baby, thus preventing hypothermia. As we know, the womb temperature will be different and the outer environment will be different temperature. So immediately after coming, the baby may get hypothermia. Maybe to prevent this hypothermia, this vernix caseosa will do its work. It will protect the baby from hypothermia. So nowadays, pediatrician what they advise not to remove this vernix caseosa, just clean with the warm water enough. They will advise. But why our acharyas were using this and how they were using this, we will see. Soon after birth, the baby should be smeared with ghee mixed with saindava. Ghee means nothing but grita. Grita with saindava will be mixed. It will be smeared to the baby's skin. This throws light on the fact that our ancient scholars were aware about maintenance of thermal stability. Grita, being the bad conductor of heat, may give the sufficient protection from the hypothermia. Saindava is surpisa. It will be slimy and sticky, so that it will remove the stickiness of that vernix caseosa. So our acharya were also were having idea about the hypothermia. So they added saindava with grita, because what this grita will do, it is a bad conductor of heat, right? It will protect from the hypothermia, and saindava will remove the stickiness. And this was about the Ulbashodana. And coming for the next, that is Mukhavishodana. Next is Mukhavishodana. What is this Mukhavishodana? Aims at the removal of fetal membranes from the air passage and mucus from the nasal or oral cavity of the baby. What this Mukhavishodana will do? Whatever mucus or mucous membrane will be present in the air passage of a newborn, it will be removing from the newborn's baby's air passage. The mucous membrane or mucus present in the air passage removal is known as Mukhavishodana. In most of the cases, normal labor is mostly accompanied by obstruction of airways by mucus plug or fetal membranes. This may inhibit inspiration and causes asphyxia. So, if it is present in the air passage, it will obstruct the airway. So, we should remove this. And if we didn't remove, it may cause the asphyxia. In Ayurveda, manual removal of mucus plug or fetal membrane with sterilized cotton swab is advised. How they will do this? Athasya talvoshta kanta jivma pramarjana mara betangulya suparilikhita nakhaya suprakshalito padhana karpasa sapichu matyaha. Charaka, it is explaining Charaka Samhita. His palate, lips, throat, and tongue should be wiped with attendant finger from which nails are properly trimmed off, well cleaned, and covered with cotton swabs. This provides extra stimulation to baby central nervous system for initiation of respiration. This is about the Ayurvedic part. What they will do? They will clean the tongue, palate, everything with the finger of a attender. It should be trimmed, nail should be trimmed and cleaned. The cotton swabs should be rolled, and they should be cleaning the mouth and nose, all air passages. It will stimulate the respiration system, and it will clear the passage. That only in modern, how they will do this? In modern neonatology, gentle suctioning is given to remove the fetal membranes and mucus plug. In cases of excessive fluid aspiration, endotracheal intubation can be done. This is about the modern. In modern, like nowadays, what we are doing, we are not practicing this finger one cleaning, right? We will go for gentle suctioning, and in chronic conditions, endometrial intubation will be done. This is about the Mukhavishodana, that is third procedure of Jatamatra Shishu Paricharya. Coming for fourth point, that is Garbhodaka vamana. The fourth point is Garbhodaka vamana, that is, it is practiced by which drugs are administered to the baby so as to make him vomit the aspiration fluid. If any survival diseases like maybe survival or severe diseases like Ulbashodana can arise if this fluid is not vomited out. And whatever the aspiration of the fluid, maybe amniotic fluid or meconium has done, it should be vomited out, or else these severe diseases, complications of that obstruction of air passage can be caused. So vomiting should be included with Grita mixed with Saindava. What they were doing, Grita and Saindava, they were mixing and they were licking to a newborn baby so that the baby will vomit all the aspirated fluids. But these also nowadays it is not practiced because extra stress by the vomiting, artificially vomiting of a baby may cause the stress in a babies. As babies will be sensitive, it may cause over stress. So it may hamper the baby's development. So what they are doing now, the aspirated fluid can be removed by a wide bore catheter. The suction of oral cavity, oropharynx, and hypopharynx should be done. The suctioning they will do, and they will remove these aspirated fluids according to our new technology. If the fluid is meconium stained, the endometrial or endotracheal intubation should be performed. Is this aspirated fluid if it is mixed with meconium, then the intubation they will advise for nowadays new technology. So this was about the Garbhodaka vamana. The next procedure in Jatamatra Shishu Paricharya is Abhinala Nabhi Nala chhedana. Nabhi Nala chhedana vidhi. That is nothing but cutting of umbilical cord. The procedure of cutting of umbilical cord and taking necessary precautions to prevent its secondary infections is known as Nabhi Nala chhedana vidhi or Nadi Kalpana vidhi. This is the last procedure of Jatamatra Shishu Paricharya. When to cut? Okay, we came to know Nabhi Nala Chhedana Vidhi is cutting of umbilical cord. When to cut? The cord can be clamped and smeared when the baby gets devoid of prosticlatia and attains proper respiratory and cardiovascular functionings. Within 1 minute, as we got to know, Pranapratyagamana should be conducted within 1 minute. Within 1 minute, at any time, when the baby is normal, we can cut the umbilical cord. This period of time facilitates the entry of around 100 to 150 ml of blood from mother to neonate, which is rich in immunoglobulins for boosting the immune mechanism of a baby. If we cut after 1 minute or within this 1 minute's time, the immunoglobulins will be passed from mother to neonate. Immediate clamping of cord is advised if the baby is preterm, cases of RH incompatibility, baby of diabetic mother, asphyxia, and in cases of low birth weight. As we came to know, till 1 minute we can cut. But if in these cases, like if baby is preterm or RH incompatibility or mother is diabetic or there is asphyxia or any other complications or baby is low birth weight, in such conditions, immediately after baby coming out, we will clamp the cord and we will cut the umbilical. What all materials we're using before to do this Nabhi Nala Chhedana Vidhi? That is, materials are Ardhadhara Shastra and Karpasa Sutra. They were tying the umbilical cord with the Karpasa Sutra and they were cutting with the Ardhadhara Shastra. And post-operative medicaments, like now we will clamp the cord. But before, what they were using? After cutting umbilical cord, they were applying Kushta Thaila, Lodhra Madhuka and Priyangu, etc. Kushta Thaila they were using, or Lodhra Madhuka and Priyangu they were using post-operative after cutting of umbilical cord. But according to our acharyas, they gave different terms to cutting this umbilical cord. That is, according to Acharya Charaka, the umbilical cord should be tied with Karpasa Sutra at a distance of 8 angulas from the navel side. Then it is cut just above the knot with Ardhadhara Shastra. The other end of the sutra is loosely tied around the neck of a baby to prevent further contamination and chances of bleeding, according to Charaka. Whereas, according to Ashtanga Hridaya, has a difference in opinion about the distance at which it is to be cut at 4 angulas. But according to Ashtanga Sangraha, state this 2 knots should be made by cotton threads and cut in between. That is, according to Acharya Charaka, he say from navel side, keep the distance of 8 angulas, tie with the Karpasa Sutra and cut. But according to Ashtanga Hridaya, he say in distance of 4 angulas, he can tie the knot and you can cut. But according to Ashtanga Sangraha, he say tie the 2 knots and cut in between with the Ardhadhara Shastra. Our acharyas have different opinion according to the cutting of umbilical cord. After cutting, same. Everyone explained that the other end of the Karpasa Sutra should be tied to the loosely to the neck of a baby so that bleeding and other contamination or other infections may be prevented. According to Acharya Dhallana, this procedure is to prevent further leakage of blood from the cord. After the procedure, the stamp has to be smeared with the Kushta Thaila to prevent secondary infections and easy healing. Why they were using this Kushta Thaila? To prevent the infections. So this was about the explanation of Jatamatra Shishu according to our Ayurveda. That is Pranapratyagamana, Ulbashodana, Mukhavishodana, Garbhodaka vamana, Nabhi Nala chhedana. So coming for the modern point, that is immediate care of newborn as per modern neonatology. What all care they will do? Soon after delivery of the baby, baby should be placed in a tray Tray should be covered with dry linen cloths. Head should be put slightly downwards. Tray should be better placed in between the legs of the mother. Leg of mother should be lower position. These all immediately after birth, what we will do? That is, we should place the tray on the abdomen of a mother with the cotton cloths or linen cloths. We should place a baby. Air passage. What about air passage? Wipe the air passage, clear the mucus and liquor from the mouth by suctioning, mouth and then nose. This we saw, even suctioning we saw in a practical session of neonatal resuscitation, right? And next, within 1 minute, what should be done? The Apgar scoring should be counted within 1 minute and at the age of 5 minutes. What is Apgar scoring? We'll see in the session of examination of a newborn. And clamping and ligature of cord should be done. How you will do this? Clamping by 2 knock jerks, forceps at a distance of 5 centimeters from the body. 2 reef knots 1 centimeter apart is made and 2.5 centimeter away from the umbilicus. Cutting the cord with the scissors should be done. Strict aspectation of precautions should be taken. Presence of cord abnormality should be tested and cut the end cut should be covered with the sterile gauze. After confirmation of bleeding should be arrested. After confirmation of arresting of a bleeding, the gauze should be wrapped and the umbilical cord clamp is given to an umbilical cord or placed to the umbilical cord. The care at birth. After baby has established breathing, effort to prevent the hypothermia should be done, like warm to a baby. Baby should be wrapped with warm cloths, cotton cloths, and gestational assessment should be done. Nothing but Apgar scoring you can do, and the 2 identical bands should be tied to a baby and a mother because all newborns will be same. So we should tie a baby off. Mother's name should be not tied to a baby and mother wrist. Both hands should be tied, and you should advise the mother to give a breastfeeding for every 2 hours, and immediately after birth within 2 hours the breastfeeding should be done. And you should advise a mother to maintain contamination hygiene condition to a newborn, and baby's vitals should be checked, that is within 12 hours to 24 hours. Both urine and meconium should be passed. Meconium here is nothing but stool. The first stool of a baby, which will be very black in color, that is known as meconium. It should, urine and feces, both should be passed from 12 hours to 24 hours. Within 24 hours, both should be passed. And you should advise mother to keep skin to skin touch and keep the baby warm. And if any baby having any complications or side effects within 24 hours, immediately you should refer the baby to the pediatrician or higher authorities. And normal routine care. If baby is normal, you can go for the normal routine care. If baby have any complications, according to the complaints, you can go for the physicians. So this is the first part of Navajata Shishu Paricharya, that is Jatamatra Shishu. What all we saw in Jatamatra Shishu? Pranapratyagamana, Ulbashodana, Mukhavishodana, Garbhodaka, vamana, and Nabhi, chhedana. Pranapratyagamana here is nothing but neonatal resuscitation. Ulbashodana, that is removal of vernix caseosa. Mukhavishodana, clearing the air passage. Garbhodaka, vamana, clearing the aspirated fluids or meconium. And Nabhi, chhedana, that is cutting of umbilical cord. These in the modern part, immediate care of newborn, what all conditions will be held, we saw. So this was about the Jatamatra Shishu Paricharya. Next class, we'll go to the Sadyojata Shishu Paricharya. What we saw is Jatamatra Shishu Paricharya is immediate care till cutting of umbilical cord from birth. Then in Sadyojata, with these we'll see what all procedures will be included. Thank you.